I'm Dr. Epstein, here to discuss the 2 ways to fix scarring from prior hairline lung surgery. These are typically cases that get referred to me or patients find me. I do 3 or 4 of these hairline lung surgeries every week, and typically the great majority of my patients are able to even brush their hair back without any visibility of the scar. Small percentage do wind up getting grafting, but that's the exception rather than the rule. But just today, I did a woman who came to me with you can see here, a widened scar, unhappy with the results, not really any hair growing through the scar, and it was widened. And I basically decided in her case to do an excision. And you can see how I was able to excise the entire scar, leaving what will be a much finer line with hairs growing through the scar. I didn't need to do, and it wasn't really much advancement. Sometimes I will do advancement of the scar, but in this case, I just basically cut out the scar and closed it in a trichophytic fashion. The other way to repair a scar is with grafting. You can see that in this video. These photos of before and after of grafting, before and immediately after. Grafting is another effective way, but sometimes if the scar is too wide, such as this patient, my recommendation typically is to have the scar excised. Anyway, this is Dr. Epstein. I want to thank my patient. Thank you.